Now, we did till the formation of blastocyst. So as we know that there is a zona pellucida around the blastocyst, then the outermost layer is a trophoblast, then there is an inner cell mass or the embryoblast, and there is a cavity that is known as blastocele. Now, this blastocyst, it reaches the uterine cavity till 7th to 8th day after fertilization. After fertilization, as the 5th or the 6th day is approached, this zona pellucida starts thinning out and it finally disappears. Now this zona pellucida will finally disappear. Right? Now what happens with the disappearance of zona pellucida? This process in which this disappears is known as hatching of the blastocyst. As the zona pellucida disappears, this blastocyst, which has now reached the uterine cavity, now will start burrowing itself into the endometrium of the uterus. Right? So this is the uterus, the uterine tubes or the fallopian tubes. Now the blastocyst has reached the uterine cavity. This is the cavity of the uterus. Right? So it has reached here. Now, with the disappearance of zona pellucida, this structure will stick. It will stick to the endometrium, and then the trophoblast, this trophoblast layer will produce some proteolytic enzymes that will help the blastocyst to burrow deep into the uterine endometrium. This type of implantation, this is known as implantation, and this type of implantation is known as interstitial implantation, where the blastocyst has implanted into the wall of the uterus. There is another type, that is the central implantation, that is there in the animals, where the embryo grows in the uterine cavity. The implantation occurs in the uterine cavity. And then there is another, that is the eccentric implantation, in which the implantation occurs in the crypt in the uterus. Crypt means the endometrium, that means the lining endometrium. It shows a fossa, shows a depression where the blastocyst implant. So there are three types of implantation. One is central, that occurs in the cavity. One is eccentric, that occurs in a crypt, that again occurs in the animals. And then there in the guinea pigs and all the humans, there is a interstitial implantation in which the blastocyst it implants into the uterine endometrium and burrows deeper into it, right? So now, what is the role of zona pellucida? Why was it till now, and now why has it disappeared? Now this implantation occurs at around between 7th or 8th day till the 12th or 13th day. That means the end of the first week until the middle of the second week, the implantation has occurred. Now zona pellucida, which was around this entire structure till now, what was the main role of it? It was preventing the implantation from occurring anywhere in this route. Right? It was preventing the implantation from occurring anywhere in this route. What happens if implantation occurs anywhere else? That condition is known as the ectopic pregnancy. That is known as ectopic pregnancy. There can be abdominal ectopic pregnancy. There can be the most common one, that is the tubal. That is in case of 95% of the cases that implantation occurs in fallopian tube. So, if any female, mostly the primigravidas, if they come with 4 to 6 weeks of amenorrhea, that means absence of menstrual periods, and they come with a history of abdominal pain and nausea, vomiting, and the first suspicion should be of the ectopic pregnancy. That is very common, and you have to exclude that diagnosis. If you do not take care of that, if the ectopic pregnancy it is allowed to grow, then obviously it will grow in the uterine tube, whose diameter is very narrow. So there is a risk of the uterine rupture. That is a medical emergency. So that is not to be missed out, right? And then what is the most common site of implantation then? The normal implantation that occurs in the uterine cavity, the most common site is in the upper part of the uterus. In 45% of the cases, it occurs in the posterior wall. In 55% of the cases, it occurs in the posterior wall, and in 45% of the cases, it occurs in the anterior wall. So the most common part is the upper part of the uterus. Now, there is another condition that is known as placenta praevia. What is that? If the implantation occurs in the lower uterine segment, then that condition is called placenta praevia. So, in the lower uterine segment, it can partially or completely occlude the cervix. So this can lead to bleeding, and this placenta praevia is a very common cause of antepartum hemorrhage. So it has to be taken care of. So we come to the next very important question, that what is the role of zona pellucida? First, we have done that it prevents the implantation anywhere else, right? So it prevents any ectopic pregnancy. Another is before the implantation. It plays a very important role in gamete identification, the sperm adhering to the ovum, penetration of the sperm. Besides this, it has a very important role in immunosuppression. Now, what does that mean? As we all know, the newly formed zygote or the embryo is completely new to the mother. It is a foreign thing to the mother. So, mother can initiate an immune response to the newly formed embryo and thus completely destroy it. But the zona pellucida around this structure, it lacks, we'll say it doesn't have the histocompatibility antigens. So when it doesn't, the outermost layer doesn't have any histocompatibility antigens, it would not initiate any antibody response. Another question can be, you can have a doubt that at this step the zona pellucida, it disappears. So now there can be an antibody response, but the answer to this is, though it disappears, at this step the implanting blastocyst, it produces some immunosuppressive proteins and the cytokines which suppress any antibody response. So these are the important functions of the zona pellucida.